Okay, so it's day something. Is it day 5? Yeah, well, it's Friday anyway, so yeah, so we're getting to the weekend. Last night was the first night that I got to sleep without being attached to anything, which was really good. So I didn't really have to worry about turning or where my arms were positioned or machines beeping. It was quite good. I only woke up 2 times, both just to go to the toilet, so it was good. And the nurse still has to sort of help me. I can get up out of bed okay, but I just have to be guided to the toilet because I'm still a bit unsteady on my feet. But no, that was good. The second time I woke up, which was about 4, that was when the pain was just starting to kick back in again, because I've gone off the PCA pump and I'm just solely on oral medication. There's a bit of an adjustment period, so yeah, the 4 o'clock, it was quite hard once I got back to bed. I was really sore, so they gave me another dose of the methadone, just a half dose, which really helped, because I think if I didn't have it, then by the time my regular dose at 8 o'clock, I would have been quite sore. So yeah, once I had that, I basically slept through just those couple of times getting up, so that was good. And I got to sleep in a couple of different positions. Like, it's quite easy just to roll onto my side and sleep, and then sort of roll back on my back. So it's good just to vary the positions. So what happened today? This morning was good. So I got up, had a full breakfast this time. So I had toast and fruit and cornflakes. It was good. So that was quite a full-on breakfast. And was feeling really good this morning. Got up with the physio about 10, I think, or whenever that
11.
was. When was it?
11ish.
Oh, yeah, 11, yeah, whenever that was. And so we went for a walk up there, and they say they try and get you to do 3 laps, which a lap is walking down to the end of the corridor where I walked last night. Then if you go along and then back up and then back through the nurse's station to just opposite where we are, that's a lap. So they kind of try to get you to be able to do 3 of those.
Every day.
Yeah, and before you leave, that's sort of the goal. So I did 1 on my first attempt, which was, yeah, they said that was really good. And I did it non-stop. And then by the time I got back here, I just sat in a chair for a while, because I want to get you up sitting as well. So I sat in a chair for about 10 minutes. And then it was I was fine up until then. It was all downhill from there, because I felt quite sick in the chair. And then, so I had to get back to bed. And I was like really nauseous then. And had to take some, they gave me some anti-nausea pills and that sort of thing to try and calm it down. So after sitting for a while, just sort of trying to get my head back here, then I was sort of sick after that. I threw up. Oh yeah, no, we can pause for a while.
Some gabapentin.
Oh, and still the gabapentin? Yep.
Yeah.
Okay.
Nobody
Yeah.
stopped it, so.
Yeah, okay, I just
Yeah.
thought someone mentioned they're going to stop it.
You look a lot better now than you did earlier on
I do
today.
feel a lot better. I was up, I got up to have a wash just before, sort of had a wash in bed and then finished off. I actually stood in the shower. I probably could have turned the shower on, but I just sort of finished
we
off.
can save that for tomorrow.
Just with a wash, and then the end of that I was a bit lightheaded, like I had to sit down, but at least I was sort of up and around.
Yeah, doing a wee bit more
Yes.
as well.
Yeah. So.
But that Norm helped you.
Yeah, it did. Yeah, it was a good sort of.
In between.
Yeah, in between gap. I think that's what helped me. Yeah.
So I'll tell her, you to have some.
Okay. Yeah. So I should just ask. They're not going to time it to give it to me. I should just ask for it.
Ask for it. Just say,
Okay.
because you can have it every you probably. What time did you get up? last night? Do you remember?
It was 4 o'clock was the one that I needed the extra
Yeah.
dose. Yeah. So.
Did you get up, go for a wee?
Yes. Yeah. I got up at sort of 12:30 for a wee, and at 4 o'clock, and it was that 4 o'clock
Okay.
one, which was.
So maybe 12:30 because that'll see you through.
Yeah. Okay.
And yeah,
Yeah.
because you can have it twice
Right.
overnight if
Okay.
you need.
Yeah.
Mm.
So I'll have it earlier and just see if that gets me.
Absolutely.
Yeah. Okay.
Don't just put up with it.
Yeah.
Okay.
Cool. Yeah. All right. And I'll talk.
Oh.
Okay. Yes, we're back. I just had to talk to Marianne about just a rash that was developing. That there's nothing to worry about there. I'm just gonna wait and see what happens.
So where is the rash?
Oh, there's just a rash up around. I just didn't want to show off. Just sort of around the sides up here, the boxes. So it's probably just. Yeah, it's nothing to worry about at the moment. We'll just keep an eye on it because it's not bothering me. But yeah, so that's sort of So it's pain relief time, which is good. Yeah, the gabapentin, which I thought they were stopping, they're going to keep me on. So yeah, that should give me a bit more relief as well. And yeah, as you heard, I'm kind of needing a bit of extra. I'm supposed to get doses in the morning at 8 and then in the evening at 9 or 9:30. But I kind of need something in between. So that's good. Yeah, so where was it? Yeah, so I was sick today and just really nauseous, so I'd thrown up. Kind of recovered because then it was lunchtime. I sort of had a sleep then until lunch. Woke up feeling a bit better. Had some lunch and then we were off to get x-rays. So I've got the x-rays of my back, of the after x-rays, which is good. But yeah, going down to the x-ray, yeah, it was a bit of a challenge. It's just the nausea is like, it was like really getting to me. So I mean the back pain is kind of secondary to that because the nausea really stops you from, like you can't get up and do anything, like it's, because you kind of want to get up and move as much as possible, but the nausea sort of stops you. But, so they did give me some more anti-nausea medication, which kind of helped. By the time I got back up here, yeah, we're then I was going to get my measurements again, so get my height and weight measured. So yeah, I walked down to there, which is to walk down the hallway, which the body was fine with it. It's just just my head is just not cooperating. I'm a bit lightheaded on my feet and yeah, nauseous really. So they've given me a bit right now. I'm sort of feeling a bit better. I had a good sleep this afternoon and had dinner, had fish and chips for dinner, the speciality of hospital, which is good. A bit of pavlova for dessert. And yeah, just sort of slept after that, had a wash. I was hoping to get a shower today, but I just haven't really been up to it. So we'll hopefully do that tomorrow, but had a good wash, I've had a shave, which feels better. Yeah, had a clean around. So yeah, that was that was Friday. And so I saw the doctor actually popped in as well. He's going to be in tomorrow. I'm going to talk to him better tomorrow, but he was talking about how the operation went. He said it went quite well. It was quite tough to reposition my body because yeah, my spine is very rigid, like just because of my age, the age, and just it's grown. It's just kind of everything's fixed in there. So he said they managed to go from, it was about 85 degrees, they've gone down to 60 degrees for the curvature, which is good given working with what they got. I think they did mention before the surgery they were trying to get down to 50, but they got to 60, which I mean, the main thing is just at least we know it's not going to get any worse. Like at least now it's fixed in position. I mentioned, you probably noticed that the top of my back is still sort of hunched over a bit. It's just because I can't really use my upper back muscles at the moment. It's just too sore. I need to relax through there.
So I just mentioned that to the doctor, and he's basically saying, I mean, it's not for another 6 months that you'll sort of know that your body will sort of get into its natural shape, so I'm just going to have to work on once the pain sort of subsides and I can actually actually just sort of work the muscles there and be able to sort of put my neck back and stand up, then we'll probably see the results. I mean, I'm never going to have like a fully straight back, but I mean, they've done the best they can. They've done a really good job, so I'll just have to work with that. So that's it for today.